but it depends on the purpose of the Morpheus. You can set it up for just doing skin retraction, or you can set it up to do some lipolysis.
People come in and they have that heavy jowling or the heavy submental area. So I really focus on going to that 3 millimeters, 4 millimeters. And now with the newer Morpheus, we can go to 5 millimeters. That's how we address those fat areas. But we let the patient know, like, hey, we're not gonna mess with your cheek area. We'll make sure you still have those high cheekbones. We're not gonna break down any fat there, just so that you have a good contouring of your face. Same thing with body, which I know most people that come in with wanting Morpheus on their body, they really want that fat breakdown. So we make sure the patient knows that we go to a level where we really break down those fat cells for them, but also give them the skin tightening as well.
So what's really been the game changer is InMode's support, and they're teaching us that clinical decision making through the different programs they have. So Morgan's gotten really good at the face, and she's even taught me some of the techniques for the body. But you can use the variability and the versatility of the Morpheus to address the issue of fat loss. Meaning, there are times when you do want fat loss. There is times when you don't, and it's based on the anatomy, your knowledge of that, and InMode's very good at teaching that, where to use it, where not to use it. It's not difficult to understand or apply. We've not seen excess fat loss be a problem, and we've been pleased with fat loss where we want it as one of the results.
If you want to use Morpheus8 as a tool to get rid of fat, you have to set the depth at the right level. So anything beyond 3 millimeters, you know that you're going to be targeting the subcutaneous fat. So that's why it's so important to go to a provider that's trained and knows how to use this piece of equipment, because once you hit 3 millimeters or deeper, you can target that fat. But I'll take that question further. If somebody's scared or concerned that they don't want to lose the fat and they have heard, I have found myself educating patients, telling them, if we use the technology right and we stay within the right depth, there's no way we're going to risk losing the fat that we want. It's all about education. It comes about education, letting the patient understand that we have different levels or layers in our skin. And when the skin ends, or the dermis, that's where the fat starts. We call it the subcutaneous fat. Anything above 3 to 4 millimeters, it's already at the fat level. So if somebody's concerned that they heard or they read that Morpheus can kill the wanted fat, we can make them ease their minds, understand what we're going to do, and stay within 1 to 2 millimeters for skin tightening, avoiding the risk of losing the fat.
So fat loss in certain areas is a big topic. There's certain areas that we don't want fat to be lost, and there's certain areas that we do want fat to be lost, such as submental and, of course, body as well. And so when I talk to my patients, I really go over all the different layers of the face. We have our skin, our superficial fat layer. We have our SMAS, which is our muscle layer. We have our deep fat, right? And so as we age, we understand that aging happens in a very predictable manner. You get that gliding motion because our deep fat is lost quicker than our superficial fat. So for certain instances, we can go superficial, really target the extracellular matrix in order to build more collagen and elastin and not losing fat. However, in our abdomen, in our flanks, in our inner thighs, in the arms, which is the most stubborn area that, even I need it done, we're using Morpheus in those areas because not only can you target the fat, but you also target the skin for that nice skin retraction. So you gotta have both. A lot of the cold energy devices out there don't do that. And so really being, an expert in the field of body and face contouring, Morpheus has everything that you need to really get to the different layers that can give your patients the outcomes that they deserve.
Every time I see a patient, I say, what do you want to change about yourself? A lot of people say, oh, I hate this part. Okay, well, we'll assess what do you hate about it, how do you want to look, and then we do custom contouring with the Morpheus8. So we'll target all those the adipose tissue to kind of give them like a snatched jawline. The way that I assess it is more so like how much fat do we have there and how much we can boost up the Morpheus to give that patient those results.
Morpheus8 is a very effective treatment when used with the proper setting. So it all depends on personalization for your treatment plan for the patient. So under the eye, we try to go lighter in settings and to not worry, because even though the Morpheus device has the ability to help with fat burning in certain areas, when it comes to the eye area, we're very careful with our settings so that we ensure that we don't cause any hollowness around the eyes.
With any device, the user, whether a doctor, an NP, or whatever that's using the device, they have to understand what that device does. So if it's done in the right hands and you understand the anatomy, and that's why when I talk to other physicians about Morpheus in particular, that person has to understand the anatomy. And in terms of fat loss, obviously, there are areas where we want fat loss, but there are other areas where we do not want fat loss, depending again on that anatomy. So if you understand what this device does and the capabilities of this device and the anatomy, it's a very simple tool because all of the technology, the InMode company has provided that technology for you. And if it's used in the right hands, it can be utilized and you can get great results.
So it truly is up to the provider to know what they're doing and why, and to properly assess and select the proper patient selection, the proper settings. So it all comes down to ultimately what the client's goal is, the settings that you use, and to collaboratively decide like what the patient wants. Do they want to keep their fat and just, have the skin tightening benefit, or do they really want to contour and reduce that submental fullness? So at the end of the day, it depends on what the patient wants, what their goals are.
When we're assessing for fat loss in certain areas, when we do our full consult, we're obviously being in tune to the settings that we're going to need to use in case we do want fat dissolving, such as our submental area or buccal fat, but staying on DRG with those guidelines and really following that just helps us give our patients exactly what they want.